Hi Allison, I'm Laura. I'm going to be your nurse today. I'll be performing a head-to-toe physical examination on you, mostly observing your upper body, your head, your neck, and your eyes, ears, nose, throat, lungs, and heart. Do you have my permission and consent?
Yes.
Wonderful. Let me know at any time if you feel uncomfortable. So I'm observing your general appearance. You appear well-groomed and alert. Your skin color looks normal. And without any noticeable pallor or cyanosis, and you look comfortable. I'm going to inspect your scalp and your face. Okay, any tenderness?
Nope.
Wonderful. So upon palpation, everything's clear and normal. Your facial features are symmetric and there's no abnormalities or skin lesions. Next, I'm going to test some cranial nerves, 5 and 7. Please raise your eyebrows. Wonderful. And frown. Smile real big and squint your eyes real close. Wonderful. Now I'm going to test for some sensations for cranial nerve 5. Let me know if you feel it. Me touching you?
Yep.
Is it sharp or dull?
Dull.
Great.
Dull.
Wonderful.
Dull.
Perfect?
Dull.
Great. One more time.
Sharp.
Good?
Sharp.
Great.
Sharp. Sharp.
Perfect. Everything's intact there. I'm going to do some palpating of your masseter and your temporal. Clench your jaw. Perfect. And clench. Perfect. Equal bilateral. Next, I'm going to check your vision. So you're going to read 20 feet away and tell me the smallest line you can see.
LTFPH.
Wonderful. And your left?
LTFPH.
Wonderful. And now read both.
LTFPH.
Great. You will able to read the line 20/20. So that is your vision. I'm going to check your near vision. And hold this. Great. And read the lowest line. Cover your eye, please.
LTFPH.
Great. And switch and read the smallest line.
LTFPH.
Perfect. 20/20. I'm going to perform some eye movement. I'm going to move my fingers and you're going to stare at my fingers, not move your head, please. Perfect. Inspecting the position, the alignment of your eyes, everything seems symmetrical and there's no abnormalities noted. I'm going to inspect your eyelashes and eyelids and make sure there's no signs of drooping, also known as ptosis, swelling. Your eyelashes are evenly distributed and everything looks normal with your lateral apparatus, including no redness, swelling, edema, no tearing, and there's no signs of jaundice or discoloration. I'm going to take my pen light and I'm going to check for your pupillary reflex. Ready? Just stare at me. Perfect. Perfect. So when I shine the light into your right eye, both your right and your left pupils constrict. That is normal. That's called consensual response. And both pupils upon inspection were equal, round, and reactive to the light. Follow my finger. Good. Perfect. And accommodation is checked as well. Next, I'm going to look inside your eye. Okay. Perfect. So upon examination, there's no abnormalities. The discs are sharp and the vessels look good. I'm going to inspect your ears. Any pain or tenderness?
No.
Wonderful. They're symmetrical. There's no deformities. No masses. And I'm going to look in your ears now. Perfect. So upon your left, the cone of light is at 7 o'clock, and right, the eardrum is pearly and gray and intact, and your cone of light is at 5 o'clock. So both ears look good. Next, we're going to do some hearing tests. The Weber and the Rhine test. So I'm going to strike this, and I'm going to place it in between your And just tell me if you hear the noise, the sound, in both ears.
Yes.
Perfect. And I'm going to strike it again, and you're going to tell me when you are done hearing the sound.
I'm done.
Great. Do you hear that?
Yes.
What sounds louder?
The second one.
Perfect. I'm going to do this side.
Done.
Perfect. What do you hear more?
The second one.
Great. That means air conduction is greater than the bone conduction, which is normal. Okay, I'm going to do a whisper test. I'm going to come around you and I'm going to whisper a couple things. Repeat that.
4, 2, 8.
Great.
Ball, cat, fence.
Perfect. So you're able to repeat everything. Everything is normal. Okay, next I'm going to examine your nose. I'm going to do an external inspection of the symmetry, and if there's any swelling or skin conditions, everything is normal and symmetric. I'm going to check your patency. Can you take a deep breath? Great. And another deep breath. Any trouble?
No.
Wonderful. So nasal passages are patent bilaterally. I'm going to palpate your sinuses. Let me know if you have any discomfort here.
No. No.
Wonderful. So no tenderness. Overall, the frontal and the maxillary sinuses are clear. Next, I'm going to look in your nose, inspecting your nasal cavity with my otoscope. I'm going to use a bright light. Tilt your head up for me, please. Wonderful. So I'm going to inspect the color. Okay, nasal spectrum appears midline, no deviation or perforation. The mucosal is pink, moist, and healthy, no swelling, redness, or signs of infection. The turbinates are normal with no swelling or polyps present. Your nasal cavity is clear, the mucosa healthy. Good news.
Cool.
Great.
Thank you.
Okay, I'm gonna test your sense of smell. Close your eyes. Let me know when you can smell something.
I smell it.
Wonderful. What do you smell?
Mint.
Wonderful. Okay, so I'm gonna inspect your oral cavity. The buccal mucosa, which is your cheeks. I'm gonna put a light in there and you're gonna feel a little stick, which is called a tongue depressor. I'm going to look inside your mouth. Open up. Great. Wonderful. I'm going to use my stick just to move things around to make sure the gums look clear. Check the lining of your cheeks. Perfect. No abnormalities. Pink, smooth, moist, no lesions or discoloration. I'm going to look at your gums. So I'm just going to take a look around. You can just open your mouth. Good. Perfect. I'm just going to look with my light. Great. Perfect. Gums are pink, firm, no signs of swelling, bleeding, or recession. Everything looks healthy. All right, let's note there's no odor found. Next, we're going to check your tongue, which is cranial nerve 12. I'm going to examine your tongue and look at its appearance, movement, and strength. Do you want to go ahead and stick your tongue out for me? Perfect. Let's note that there's no abnormalities, lesions, or discoloration or deviation. The tongue appears midline and indicates normal functioning cranial nerve 12. Tongue movement. Let's move your tongue side to side. So side to side, up and down. Perfect, symmetrical. Push your tongue against your cheek and I'm going to press. Perfect. And this side. Perfect. Put your tongue to the roof of your mouth. I'm just going to check out inside your mouth again. Good, and drop your tongue down. I'm going to look at your hard palate and your soft palate, make sure everything's intact, smooth, pale pink, and there's no lesions or abnormalities. Stick your tongue out for me and say ah. Perfect. Your uvula moves midline and up when you say ah. Everything seems normal. Tonsils are not enlarged, and there's no redness or swelling. I'm going to inspect your pharynx, cranial nerve 9 and 10, which is your gag reflex. Say ah. Okay, gag reflex is intact. Sense of taste. Tell me, I'm going to hand you something. Tell me if this is sweet or sour.
Sweet.
Perfect. Next, I'm going to palpate your lymph nodes on your neck. Good. All nodes are normal, no signs of enlargement. I'm going to palpate your carotid pulse. Pulses are strong and equal bilaterally. We would consider that 2+. I'm going to palpate and auscultate your thyroid. So I'm going to come around. Okay, swallow. Perfect. Everything moves together bilaterally. Trachea is midline. And next I'm going to auscultate your thyroid and carotid. Perfect, clear, no bruise heard. So I'm gonna turn you and inspect your back now. So if you don't mind just turning for me, that would be great. For modesty purposes, I'm gonna leave the shirt down, but we would typically have you in a gown and I would be inspecting your skin, looking for lesions, abnormalities, and making sure everything appears symmetric. Just go ahead and take a nice deep breath. Perfect, everything is symmetrical both sides. I'm going to test something called tactile fremitus. So when I put my hands to your back, please repeat the word 99.
99. 99. 99. 99.
Perfect. So fremitus is equal bilaterally, which is normal findings. Next, I'm going to percuss. Perfect. Sound is resonant throughout the lungs, which is normal. Next, I'm going to check your diaphragmatic excursion. So I'm going to have you take a nice deep breath, and I'm going to do some more percussing. Go ahead. Okay, breathe out. Perfect. And one more time. And what this is showing is that normal should be 3 to 5 centimeter range, which yours is normal. And then I'm going to listen to your lung sounds. Nice deep breath. Just nice deep breaths in and out. In and out. Perfect. Lung sounds are clear bilaterally. Now I'm going to examine your anterior chest, which is the front of your chest, so you can turn towards me. I'm going to inspect the shape and symmetry of your chest. Please just sit comfortably. I'm going to observe your movements while you breathe. Perfect. Your chest is symmetric. There's no deformities, no exaggerations during breathing. Everything appears completely within normal limits. I'm going to assess your respiratory rate and pattern. So just go ahead and breathe, and I'm gonna look for 30 seconds on my clock. Perfect. We're going to say that you are at respiratory rate 16 because we take the number that we got at 30 seconds and multiply it, and that's within normal range. I'm going to palpate your chest just for any tenderness or abnormalities. You want to just sit back and relax and be nice and comfortable. Perfect. And then take a nice deep breath for me. This is checking your thoracic expansion. Perfect. Everything is symmetric, equal movements on each side while you're breathing. Now I'm going to listen to your lungs. Breathe nice and deep for me. Nice deep breath. Perfect. Lung sounds are clear bilaterally. Now I'm going to listen to your heart. I'm going to listen to your heart in several spots, okay? First is your right second intercostal space at the sternobordal. This is your aortic valve. And then your pulmonic valve, Erb's point, your tricuspid, and your mitral. Perfect. Normal findings, S1 and S2. Heart sounds are normal, no murmurs, rubs, or gallops. I'm going to lay back and check your jugular venous distension, and we're going to look at some arteries and pulses. Turn for me. So, lay back. Perfect. Jugular venous distension is not noted, so everything is normal there. I'm going to palpate and auscultate. So I'm going to lay back a little bit more so I can access your abdomen. Okay, now I'm going to palpate and auscultate your peripheral pulses, starting with your aortic and your renal, the iliac, and the femoral. Now, obviously, I would have a patient not in clothing, but for sake of privacy, I'm going to take a listen for bruits. Perfect. Pulses are present. We're expected 2+. There's nothing noted. I'm going to check the pulses of your arms and your legs. So starting with your radial pulse. Perfect. 2+. Your ulnar. 2+. Brachial. 2+. And we're going to check your underarm, which is called the axillary. Perfect. I'm going to come down to your lower extremities, so your femoral, which is right here. I'm going to have you bend your leg a little bit so I can get underneath there. 2+. Your popliteal, posterior tibial pulse, and your dorsalis pedis. 2+. Perfect. We would repeat the same on the other side, and I'm going to check your lower extremities for any edema. There is no edema present, so everything is all set. Thank you, Allison.
Thank you.